I'm here with a longtime friend, collaborator, comrade Q, who's currently based in so-called Chilliwack, BC. Q's been doing a lot of organizing specifically around the intersections of MAiD, criminalization, incarceration, in its many forms. And so I invited it to join us and talk a bit more about like the work that they're doing.
Yeah, I'm Q. As Nakshi said, I'm in so-called Chilliwack, which is specifically the land of the Chiquayak and Palalt tribes of the Stalo Nation. And I am a white settler here, and so still learning what it means to be in right relations on this land with the stewards and yeah, the people who this land was stolen from. Yeah.
So Q, I thought that like as part of the national broadcast that's happening across so-called Canada to mark Prisoners' Justice Day, you could share a little bit about what you have found as you've been working to provide a lot of public education around like MAiD, medical assistance in dying, and also how that is rolling out specifically in prisons across Canada. Because, you know, Prisoners' Justice Day started to mark that like no death in prison should not be commemorated, and deaths in prison are not natural because prisons are not natural states of being. And as you know, we've seen the expansion and rollout of MAiD, and now increasingly being accessed by incarcerated communities. It really like highlights how disposable people are truly in the state.
Yeah, absolutely. So for context, I was part of a group of disabled people, kind of led by Gabrielle Peters and Catherine Frazee, two longtime kind of disability activists, organizers, scholars, who put together an event, the so-called Disability Filibuster, back when MAiD was originally being expanded here in Canada. We've had medical assistance in dying since 2016, but since 2020, there has been an expansion that's been going at a pace that has put Canada as a international leader in eugenics. And recent expansions have meant that it is specifically disabled people who are permitted to access MAiD, which is assisted suicide, to put it bluntly, when we do not have what is called a reasonably foreseeable death. The original MAiD laws were around people with so-called terminal illnesses, which is a contested term in and of itself. And these recent expansions have meant that you do not have to have that reasonably foreseeable death to apply and qualify for MAiD. You just need to have can't remember the exact language that they use, but they cite it as like intractable suffering, and it essentially targets disabled people. And the recent special committees over 2022 and 2023 have specifically addressed mature minors and incarcerated people in terms of who can access MAiD and how. And it's been these special committees have been under the guise of implementing safeguards so that there is ostensibly less risk of coercion and abuse of power and things like that. But what advocates and activists like myself strongly feel is that by being incarcerated, you are in a state of coercion, because you don't have freedom. You don't have freedom of movement. You don't have, you often lack adequate health care. We see people dying in prisons due to that lack of health care. You know, we see um, overdoses, we see seizures, we see people, wheelchair users, being denied mobility aids and movement, um, let alone just the fact that people are in cages, and that is a coercive environment. And so yeah, I strongly oppose the overall expansion of MAiD for anyone, but I think that it is exceptionally egregious when it comes to incarcerated people, because of course this is a community that that lacks basic freedoms, and we see people being denied compassionate release, people who, even under state view, are of no risk to themselves or the public. These people are ill and dying. And while they're being denied compassionate release, they're being approved for assisted suicide. And I think that should be a very glaring lack of justice in this overall unjust system that we already have.
Thanks, Q, especially for kind of laying out the layers of what people are facing when they are incarcerated, and almost like compelled to seek out MAiD, because we know that prisoners across Canada lack adequate access to healthcare, adequate access to harm reduction, including safe consumption, safe supply. As folks who are tuning in will probably know, like there were huge COVID-19 outbreaks in prisons, especially documented at the beginning of the pandemic, because these are congregate environments that have never been designed with people's kind of health or safety or longevity, with disability in mind. And like I remember probably 10 years ago, there was already like this conversation about a coming crisis in Canadian prisons, and that was the aging population in the federal prison system. And it's hard not to be cynical and see that there's a solution that's kind of been set forth, and it's not compassionate release, it's not aging in place in a comfortable, dignified community setting. It is MAiD. And
Yeah.
you mentioned when you were speaking before, like the fact that people are being denied compassionate release and then seeking MAiD as an alternate. Can you say a little bit more about that?
Yeah. Yeah. So we actually have current coverage people can find in Canadian media. I was reading in CTV today actually about a man named Ed Spidell who has end stage chronic obstructive pulmonary disease, COPD. You know, he requires supplemental oxygen, which he has a hard time accessing. He specifically says in his interview with CTV that he had to fight really hard to get a portable oxygen tank to even do this interview. And he was denied compassionate release. I think he has legal counsel now and he's trying again. But in the meantime, since he was denied, he started an application for MAiD because he doesn't want to die in prison without anyone around, you know, with only guards around him. He spends most of his time in his cell. And yeah, he doesn't want that death, and I think that's entirely understandable. And he has specifically, named what I think the state would even find a perfectly reasonable request, which is just to, live out the rest of his days in a secure halfway house, and die peacefully in that setting. And again, has been denied for that compassionate release. This is a man who has very little mobility. Again, I think even the state would see very little so-called threat from this man who has done 41 years for nonviolent crimes. And yeah, it's just, I think it is incredibly telling that we are seeing, incarcerated people being denied this compassionate release, and turning to MAiD. We're also, Meenakshi, you mentioned, this conversation has been going on for at least a decade, where we're seeing aging prison populations, and there have been a couple um, uh, new builds for like carceral nursing homes, which I think is already such an egregious response, like such a um, just rather dispassionate and like inhumane response of like, well, we're going to keep these people locked up, but they'll have, daycare and support workers and whatnot. And I think that, there's a whole conversation about nursing homes and psych institutions as carceral healthcare. But even that has not been expanded as rapidly as medical assistance in dying or assisted suicide. And I think that we should we should be very wary of state sanctioned solutions to state violence. Like, we understand prisons to be violent. As a disabled person, I understand many healthcare settings to be violent as well. And people are being forced into terrible decisions due to just a complete lack of compassion from systems that aren't designed to be compassionate in the first place. So yeah, again, that man is specifically Ed Spidell. And I really hope that he wins his second appeal for compassionate release. It seems clear that that's what he actually wants. He's stated explicitly that he doesn't want to access MAiD. He would much rather die a natural death outside of prison. But that is not currently what he's looking at, and I think that is an incredible injustice and really a tragedy that many people are going through at this point.
And I also just really wanted to highlight what MAiD in prison means, because again, I think like a lot of folks have been kind of like they've seen a really sanitized version of MAiD, that one is totally devoid of like the settler colonial racial ableist intersections of what MAiD means. But also I was learning a little bit about MAiD in prisons, and APTN actually did a bit of coverage around MAiD to date. So they reported in April 2023 that 9 federal prisoners had accessed MAiD since it became legal in 2016. And the first 3 were killed while shackled and watched by prison staff, including guards, parole officers, COs, and family members. At the time, that's something that Ivan Zinger, the federal ombudsman, spoke out against. again, I think it just highlights like a lot of people have this like very like white notion of what MAiD looks like, right? They think it takes place in alpine community in Switzerland and it's really comfortable. But when I read this, it just read so much more like the death penalty. It also was so evocative of the ways that women who have been forced to give birth in prisons also experience shackling. So I do want to offer like folks who might be thinking like, yeah, like prisoners should have the ability to choose how they go. Like, you know, we know that that's the community that's got a lot of solid ethics around how they do things. Um, but I don't think that this is what folks imagined, right? They didn't think that MAiD would mean something so evocative of like basically the death penalty. Um, and
Yeah.
as you've talked about, and as has been like reflected in like the disability filibuster, like that is kind of what MAiD is. It is the death penalty. If you're poor, if you're just too disabled, if you're incarcerated and the system just wants to kind of free up the cell. Um,
Yeah.
And I wonder if
Yeah.
there's anything else you want to say, Q, about like MAiD and carceral ableism in general.
Yeah. Specifically to your point of people having this sanitized view, that is very intentional. You know, the expansion of MAiD came from Quebec Superior Court kind of petition to the Canadian Supreme Court of it's the Truchon case, and it's a white woman who a wealthy white woman specifically who said that, you know, she wants to be able to choose the time of her death and be able to be sipping champagne is specifically the argument that sent this down the path that it's gone. So I think that this idea that people have of, as you said, the sanitized version of MAiD is very intentional from the people who are pushing to expand it, and it doesn't look at, you know, the reality of who is going to be targeted by MAiD, whether it's poor people, incarcerated people who, of course, are overwhelmingly poor. You know, we see an overwhelming with what little data that we do have, we see that it's overwhelmingly racialized, and especially Indigenous and Black people that are accessing MAiD. And of course, Canada is terrible at sharing kind of demographic information, but I think we can yeah, be very clear on that. And you know, just to tie prisons to like other carceral settings, we're also seeing that people in psychiatric facilities that have been there for, I think it's longer than 6 months, are also able to apply for MAiD. So if you've been institutionalized, and you know, you're facing the daily violence of, again, this lack of freedom, then you can request state death. And I think it's important to be very clear that that's what MAiD is. And you know, as you said, people in prison settings, when they're accessing MAiD, um, they are overseen by their jailers, and I can't get over the violence of that, for your last moments to be in the company of the people who have kept you from freedom. I think that it's yeah, quite stark how violent that is, and that connection to um, people giving birth in prisons as well is incredibly apt. And yeah, I also liken this to the death penalty. And again, we see an overrepresentation of Indigenous people, especially accessing this, which is a continuation of colonial genocide. And there have been a number of Indigenous organizations that have been speaking out consistently about the fact that, you know, Indigenous communities have a suicide crisis, and are of course overrepresented in prisons. And yeah, again, this just continuation of genocide. It's MAiD is not about autonomy. Um, and I think that the way that many leftist communities talk about assisted suicide really needs to move away from this idea of individualized autonomy towards one of collective responsibility to one another, because that, you know, really is that individualism is deeply ableist in many ways, and we need to collectively interrogate that kind of mindset of autonomy. I think that bodily autonomy is essential, but what does that mean when you don't have actual freedom to live, and you're instead encouraged to die?
Yeah, thank you, Q. And I want to again like thank you for coming and both sharing some words for the national broadcast, for reminding folks across so-called Canada that MAiD is an issue for all incarcerated communities, including folks who are incarcerated in settings such as prisons, but also psych facilities. And I also want to thank you because you're going to be speaking at Prisoners Justice Day in so-called Vancouver on unceded Musqueam, Squamish, and Tsleil-Waututh territory, as you have in the past. And yeah, just really want to recognize you and also the work of the Disability Filibuster, for bringing these conversations to people's attention. So last May, the Disability Filibuster held a panel on carceral ableism and confinement. And I know that's not the only thing that you folks did, but it's a good kind of starting point for people who might want to kind of learn a bit more about this. So yeah, again, thank you so much, Q, and looking forward to hearing you speak on August 10th.